dangerous foods all pregnant women should avoid. Healthy eating is vital at all times, but it's even more important when you're expecting a baby. Certain foods can harm you and your unborn child, leading to stillbirth, miscarriage, foodborne illness, and other pregnancy problems. Thus, you need to plan your diet carefully and make wise food choices. Eating well can increase your odds of a healthy pregnancy and keep your baby safe. Eggplant/Brinjal. Ayurveda strictly advises the limit of brinjal consumption. Brinjal or eggplants contain large amounts of hormones, and these help in treating premenstrual syndrome and amenorrhea. Their brinjal works as diuretics. It can stimulate menstruation when consumed daily, which is not a good option for a pregnant lady. This is one of the main reasons to avoid brinjal during pregnancy. Eggplants or brinjals are enriched with menstruation-inducing properties. Due to these properties, brinjals may also lead to abortion. These are also not good as they may cause acidity problems, therefore it is suggested that women should avoid eating brinjal during pregnancy. Uncooked eggs. Many people toss a few uncooked eggs into their morning smoothies to give it a protein boost, but pregnant women should avoid eating uncooked eggs altogether. In their uncooked form, eggs pose a huge risk for salmonella poisoning. While an unborn baby can't have salmonella poisoning, the pregnant mother can't pass it on to the baby. There are several side effects that can impact the baby's health and labor. Some of these include causing early labor and dehydration, since salmonella poisoning leads to vomiting and diarrhea. Papaya. Indians consider papaya to be very dangerous to consume during your pregnancy period, as papaya can stimulate an abortion. How far this is true is still a debate. Anyhow, raw or semi-ripe papaya is quite unsettling for your tummy, making it quite dangerous during pregnancy. This is because raw papaya has sufficient traces of latex, a milky solution that is known to trigger strong uterine contractions. History has it that raw or unripe papaya was used in Asian countries to trigger abortions. Now, this would mean to eat papaya in quite large quantities. But ripe papaya is quite safe to consume, as this latex traces are not found in ripe papaya. This makes it advisable not to have raw or semi-ripe papaya during conception period. Deli meats. Deli meats are a staple lunch item in households across North America. They are convenient and cheap, make filling sandwiches, and children generally like them, but their safety related to pregnant women has been a controversial topic for years. In general, processed deli meats should be avoided during pregnancy. These meats are dangerous foodborne illness that can cause miscarriage, severe illness, and even stillbirths. The average person would feel mild flu-like symptoms, but the disease is much more severe for women who are pregnant. Pineapple. This is yet another item that most women avoid during pregnancy. Pineapple comprises of traces of bromelain enzyme that is found to be helpful in cervix softening and bringing on labor. Pineapple belongs to the family of food that gets your body heated very soon, and therefore is not recommended during conception period, as it can trigger a miscarriage or premature labor. However, one needs to understand that a single pineapple contains just minute traces of the above-mentioned enzyme, and it turns dangerous only if you have around 6 to 7 pineapples together. However, Indians believe that pineapple belongs to the family of food that gets your body heated up very quickly and thus can trigger abortion and even premature labor. This is more a myth, but Indians avoid eating this fruit while pregnant to be on the safe side. Actually, eating pineapple in small quantities is thus perfectly safe during pregnancy. And washed vegetables. Vegetables are safe and a necessary part of a balanced diet. However, it is essential to ensure they are washed thoroughly to avoid potential exposure to toxoplasmosis. Toxoplasmosis may contaminate the soil where the vegetables were grown. Feta cheese. Feta is a prevalent type of cheddar, utilized as a part of numerous servings of mixed greens and pastas, and venerated by sustenance authorities everywhere throughout the world. In case you're a cheddar significant other who needs it much additionally amid pregnancy, it's critical to recognize what cheddar is sheltered. Tragically, this sort of cheddar, alongside other delicate, unpasteurized cheddar, which we discuss later in this article, has been connected to foodborne ailment. Liver. Too much vitamin A, especially during the first few months of pregnancy, has been linked to birth defects. Liver and most live products contain dangerously high amounts of vitamin A. It would be good to also avoid high doses of multivitamin supplements, fish liver oil supplements, and any supplements containing vitamin A. Caffeine. The argument on how much caffeine a pregnant can consume has been going on for ages. Be aware that caffeine can cross the placenta and affect your baby's heart rate. Common sources of caffeine include, but are not limited to, coffee, tea and coals. Many doctors, however, recommend that pregnant women consume no more than 200 milligrams of caffeine per day. High mercury fish. Shark, swordfish, king mackerel, tilefish, and tuna are high in mercury, which may cause growth problems and brain damage. The same goes for most types of fish used in sushi. Canned tuna has lower mercury levels, but it still should only be consumed in moderation. Alcohol. Alcohol should be avoided at all costs, as there is no amount of alcohol that is known to be safe during pregnancy. Prenatal exposure to alcohol can interfere with the healthy development of the baby. Depending on the amount, timing, and pattern of use, alcohol consumption during pregnancy can lead to fetal alcohol syndrome or other developmental disorders. If you like the video, give it a thumbs up. Share it with your friends. For more health tips, subscribe this channel.